What is FIT? The Colorectal Health Kit is a fecal immunochemical test, also called FIT, and is the recommended colorectal cancer screening test for average-risk people between the ages of 50 and 74. It is a safe, non-invasive, and painless at-home cancer screening test. Why is FIT testing important? 90% of colorectal cancer is curable when it is caught early. The Colorectal Health Kit test increases the chance of finding cancer early when it is more likely to be cured. Who is the test for? The Colorectal Health Kit is available for anyone between the ages of 50 and 74 who is not eligible for the Cancer Care Ontario FIT program and hasn't been checked in the last 24 months. Anyone outside of this age group who wishes to get screened should speak with their healthcare provider. Note, people who are at an average risk, between 50 to 74 years old with no first-degree relative, parent, sibling, or child who have been diagnosed with colorectal cancer may be eligible for screening under their provincial program. Please speak with your healthcare provider for more information. How to get screened? Here's how to get screened in 2 simple steps. 1. Purchase the Colorectal Health Kit online through LifeLabs online store. The kit provides detailed and step-by-step instructions on how to collect your sample, or you can also watch the short animated film to guide you through the sample collection process. 2. Send your sample within 2 days of collection to LifeLabs, either by dropping it off at your nearest LifeLabs location or mailing your completed test in the prepaid box via Canada Post. How to access results? Your test results will be available online a few days after we have received your sample. You will receive an email letting you know your results are ready with a link that you can click on, or you can access the results by signing in the LifeLabs store where you have purchased the kit. For abnormal FIT results, you will receive a call from LifeLabs clinical partner, Trillium Health Partners, within the next 1 to 2 business days.